High-resolution imaging for real-time cancer diagnosis, an introduction to multi-core fiber endoscopy. Imagine a world where doctors can detect and analyze cancerous tissues instantly during surgery without needing to remove and examine tissue samples in a lab. This is now possible thanks to a groundbreaking technology called multi-core fiber endoscopy. Using ultra-thin fibers combined with advanced artificial intelligence, this technology allows for high-resolution, minimally invasive imaging that can reveal even the smallest details within tissues. This new method has the potential to speed up cancer diagnosis and improve the precision of surgeries, leading to better outcomes and faster recovery for patients. Let's start with the traditional way cancer is diagnosed, especially for conditions like brain tumors. 1. Surgical biopsies. In most cases, doctors need to perform a biopsy, which involves surgically removing a small piece of the tumor tissue. This tissue is then analyzed in a lab to determine if it is cancerous and, if so, what type of cancer it is. 2. Drawbacks. This process is invasive, meaning it involves cutting into the body. It can be time-consuming, causing delays in diagnosis and treatment. In addition, the procedure can be risky and may lead to complications, especially for delicate organs like the brain. 3. Limited visual guidance. During surgeries, even advanced imaging methods can struggle to show clear, detailed images of tumor tissues. This lack of clarity can make it harder for surgeons to remove the entire tumor or identify its exact borders, which can lead to further surgeries or treatments. This new technique is known as multi-core fiber (MCF) endoscopy. Here's how it aims to overcome the limitations of traditional methods. Minimal invasiveness. Multi-core fibers are ultra-thin, with a diameter of less than 1 millimeter. This small size allows doctors to insert them into the body with minimal tissue damage, making the procedure safer and faster for patients. Live imaging. The fibers can capture images of tissues in real time, providing doctors with immediate insights. Imagine a tiny, flexible camera that can reach deep into tissues and show what's happening there on a microscopic level. Improved diagnosis. The goal of multi-core fiber endoscopy is to enable what's called an all-optical biopsy. This means that instead of removing tissue samples, doctors could diagnose and study the tissue directly through images, which is faster and less invasive. However, there's a challenge. The images produced by these fibers are often distorted, with honeycomb patterns or blurred areas that make it hard to see fine details clearly. This problem is due to the physical structure of the fibers, which can interfere with the images they produce. To overcome these limitations, scientists developed an innovative solution that combines deep learning and digital twins. Here's how these cutting-edge technologies work together to create clearer images. 1. Digital twin simulation. First, scientists create a virtual model, or digital twin, of the fiber endoscope. This digital twin simulates the exact optical properties of the fiber, including any distortions or irregularities that might affect the images. Purpose: by understanding how the fiber behaves, the digital twin can help correct the distortions before they appear in the actual images. 2. Deep learning for image correction. Next, a deep learning model is trained to recognize and remove these distortions from the images. Deep learning is a type of artificial intelligence that can learn from data, recognizing patterns and making adjustments to improve image clarity. 3. Transfer learning for specific tissues. Transfer learning is a technique that allows the deep learning model to adapt quickly to specific types of tissues, like brain tumors. With transfer learning, the model doesn't need thousands of images to learn. Instead, it can achieve high accuracy with just 50 image pairs, a process that is feasible in clinical settings. Results: by using these techniques, the researchers achieved a significant improvement in image quality. The metrics of image clarity improved up to 31.6 dB, a measure of image clarity, and 0.97, a measure of similarity to a reference image, which are excellent results for medical imaging. This technology has been tested in experimental settings with very promising results. Speed: the model can process images at 14 frames per second, which means it's fast enough to provide real-time feedback during surgeries. Data efficiency: traditional models need thousands of images for training, but with transfer learning, the researchers managed to reach high accuracy with only 50 image pairs. This efficiency makes it practical for real-world use in hospitals, where data collection can be challenging. Clarity and detail: thanks to the digital twin and deep learning, the images are much clearer, showing even fine details within tumor tissues that were previously hard to capture. This improvement can help doctors identify and classify tumors more accurately. This technology has the potential to revolutionize cancer diagnosis and surgical guidance. Better precision during surgery: with real-time, high-resolution images, surgeons can see the exact edges of a tumor, improving the chances of removing it entirely and minimizing the need for follow-up surgeries. Faster diagnosis: because the system provides immediate feedback, doctors can potentially make quicker diagnoses, reducing the waiting time for patients and allowing treatments to start sooner. Broader applications: although this technology was tested on brain tumors, the same principles could apply to other types of cancer. Imagine using it for liver, lung, or other organ cancers, allowing for earlier detection and treatment. In summary, the combination of multi-core fiber endoscopy, digital twins, and deep learning offers a glimpse into a future where cancer diagnosis is faster, safer, and more precise. As the technology evolves, it could become a standard tool in operating rooms worldwide, transforming the way we detect and treat cancer for the benefit of patients everywhere.